Thank you for joining. We'll give others a chance to hop on, and we'll start this webinar in just a few minutes. I appreciate everyone for joining us today to discuss the call to secure Apple in healthcare. My name is Mike Schmidt, and I'm a strategic account executive here at Jamf. I'm joined by my colleagues Adam Derrick, who is our technical expert in healthcare, and Michael Covington, who is our VP of Strategy here at Jamf. The agenda for today's webinar will discuss growth drivers in healthcare technology. We'll then get into new risks, regulations, and recommendations. We'll then showcase how you can all achieve trusted access within your organization, and then wrap up today's call talking through how UMC Utrecht has deployed Mac security at scale. For those of you who are new to Jamf, I'd like to take a moment to provide a brief introduction of who we are. So Jamf got its start back in 2002 helping organizations better manage their Apple devices. Over the years, we've expanded those capabilities to include identity and access, as well as security. Today, we help support over 74,000 customers that have 31 million devices running Jamf, working with some of the largest companies, brands, and healthcare systems across the globe. And lastly, we help support the largest Apple IT community in Jamf Nation, with over 100,000 members to date. So at Jamf, we help healthcare succeed with Apple by providing an experience that users love and organizations trust. Our management capabilities not only simplify the end user experience, they are the foundation for meeting your organization's security objectives. Our security solutions allows you to deliver trusted access to work resources for all of your users, regardless of where work happens. And beyond management and security, our patented industry workflows and ecosystem help extend Apple solutions for healthcare. Solving unique challenges that our customers face has led us to create solutions for iPads at the bedside, along with Apple TVs in patient rooms, shared device use cases for iOS and iPadOS, and telehealth solutions to help connect providers to patients and patients to families. Combining this all together, and you can see how Jamf offers everything to manage, secure, and extend Apple deployments for your organization. So what are some of the technology growth drivers impacting healthcare today? Some of the main drivers that we've seen have revolved around three core concepts: the economic impact and return on investment that Macs provide, that offering your employees the choice around what technology they prefer and feel most comfortable with to perform their best work, and how mobility is continuing to drive change on how care is provided. So let's discuss some recent findings around employee choice and total economic impact of Mac in the enterprise. So Jamf has conducted a survey which showed that 62% of users surveyed preferred to use Apple at work. This was validated when Fletcher Previn, CIO of Cisco, took stage at our Jamf Nation user conference back in September, sharing with the world that 60% of employees at Cisco use Mac over PC today, and that 24% of PC users switched to Mac when choosing a new device. Fletcher also showcased that Macs were less expensive over 3 years than their PC counterparts. They also require 33% fewer engineers to manage the Mac program than their Windows PC program. A great example of this is our customer UMC Utrecht, who is an academic medical center based in the Netherlands. We'll discuss how Macs played an integral role as they move to employees working remotely later on in this webinar. Beyond the data and customer examples for the Mac, healthcare has seen another really exciting change, and that is the acceptance of mobile as a new standard for care delivery. A Verizon study showed that 85% of healthcare organizations see mobile devices as the primary access to cloud tools over the next 5 years, and that the global healthcare mobility solutions market estimated for 21.5% in annual growth. Lastly, UC Health in Colorado saw an amazing showcase of the efficiencies of mobile devices and apps. In early 2020, UC Health set up mass vaccination clinics in partnership with the Denver community at Coors Field. After experiencing workflow challenges with the PCs during the initial pilot test site, the team shifted each clinical team member to an iPhone with Epic Rover for their entire vaccination workflow. The result? They saw a dramatic time reduction to vaccinate a patient. Thanks to our friends at Apple, who captured the spirit and purpose of UC Health's vision and how key partners came together to make it happen.
In communities across the world, healthcare providers are facing a daunting task: how to vaccinate hundreds, thousands, hundreds of thousands, millions, a lot of people safely and fast. Registration is a big challenge, like having to use thousands of pieces of paper or bulky tethered computer stations, barcode scanners, thousands of yards of cable, power sources, and Wi-Fi routers to connect to health records kind of challenge. But UC Health in Colorado found a better way to deliver better care using iPhone and the Epic Rover app. By assigning QR codes to each patient's appointment and vaccine, the built-in camera for barcode scanning, long battery life, and 5G allowed UC Health to make what used to take 3 minutes per patient now take only 30 seconds. And that adds up. No wait time, easy check-in, accurate records. That's Apple in healthcare.
We must acknowledge that anywhere work is our new reality. We know that remote and hybrid work was already on the rise and that the pandemic only accelerated the trend. Employees are no longer sitting in an office and their workflows have moved to the cloud. Additionally, employees are placing more importance than ever on device choice programs. These characteristics define the modern workplace and bring a new set of challenges. So we discussed some positive trends of technology in healthcare. What are the new risks and regulations that you need to be aware of? Healthcare systems are increasingly falling victim to sophisticated hacking efforts, insider threats, and basic security flaws, despite the highly confidential nature of patient data. As digital health records and connected care continue growing, the healthcare sector struggles to keep pace with modern data protection standards. Per IBM, for the 12th year in a row, healthcare participants saw the costliest breaches amongst industries, with the average cost rising to $11 million per breach in 2023. This is up 9% from 2021 and 53% since 2020. Not only have costs associated with breaches risen, so have the amount of patient records affected by these. 87 million patients have been affected this year alone, and over the past 12 years, 385 patients have had their records exposed. With the main goal of providing care is keeping our communities healthy, breaches do have a direct impact on how care can be delivered. And it's showing that 75% of cyber attacks disrupt patient care. This can result in forcing some emergency rooms and primary care services to shut down and ambulances to be diverted. In 2023, there was a 134% increase in the number of patients affected by breaches in healthcare. And the number of breaches have increased by 27%, up to 480 this year, compared to 373 in 2022. Some of the top states being affected are California, New York, and Texas. So what are some of the top threats that healthcare providers face today? The Office of Information Security and Health Sector Cybersecurity Coordination Center now lists phishing and smishing via text messages as the top cyber threat in healthcare. In 2023, ransomware attacks on healthcare providers increased from 12% to 18%. Attackers typically use email and web applications as starting points for ransomware by sending fake email messages that ask for user credentials. And distributed denial of service, or DDoS attacks, are a popular tactic, technique, and procedure used by hacktivists and cybercriminals to overwhelm a network to the point of inoperability. This can pose a serious problem for healthcare providers who need access to the network to provide proper patient care or need access to the internet to send and receive emails, prescriptions, records, and information. Malware is a growing threat to an organization and individuals. One increasingly popular variant is information stealing malware, or info stealers, which is malicious software designed to steal data. Unlike ransomware, where information is held hostage, infostealer attacks happen covertly, and the growth has been driven by the explosion in connected devices, coupled with the ease of trading information on the dark web. Research by SecureWorks found that the volume of credentials for sale on the dark web from infostealers grew 150% from June of 2022 and February of 2023. So over the years, governmental regulations have been put in place to help protect patient data and privacy. Since 1996, the United States has had the Health Insurance Portability and Accountability Act, or HIPAA, that requires healthcare professionals to protect patient privacy and electronically store protected health information. Later on in 2009, the Health Information Technology for Economic and Clinical Health Act, also known as HITECH, was introduced to help strengthen HIPAA privacy and security rules, which also introduced a new breach notification rule and tougher penalties for compliance failures. In 2016, the European Parliament approved the General Data Protection Regulation, also known as GDPR, which sets the standards for privacy and security. There are harsh fines that can be placed on those organizations that violate these standards. And lastly, in Singapore, the Ministry of Health enacted the Personal Data Protection Act, which comprises of various requirements governing the collection, use, disclosure, and care of personal data in Singapore. So with those regulations, new governmental bodies were formed to provide guidance around threats in keeping your organization safe. In the US, the Health Sector Cybersecurity Coordination Center, or HC3, has released their mobile device security checklist. This document represents a basic checklist of recommended items for the health sector to maintain security. Some of the items covered are ensuring the operating system and software are all up to date. Security software should be installed as available. You want to limit connectivity, ensuring the use of VPN or a more modern approach in zero trust network access on your mobile devices, and making sure those devices are encrypted. Over in Europe, they have ENISA, or the European Union Agency for Cybersecurity. And they have put in place their recommendations for good security practices for mobile devices. There are some overlapping themes with the HC3 checklist, such as ensuring devices are always using VPN or ZTNA, ensuring devices and software are routinely updated, but they also provide guidance around establishing test policies and business continuity plans. And in Singapore, they have amended the PDPA in 2020. And that amendment includes items such as a mandatory breach notification requirement and introductions of criminal offenses. Similar to the HITECH Act here in the US, healthcare providers in Singapore will need to disclose breaches where 500 or more individuals were affected. So how can you take some of these resources, say the mobile device security checklist, and put it into action? Well, it all starts with your strategy. And for that, I'm going to hand it off to Michael.
Jamf technologies empower organizations to embrace a modern workplace that is designed to optimize end-user productivity and enhance security. This is particularly pertinent in industries like healthcare, where regulations, privacy protections, and security requirements are piling up, all while these same organizations are looking for opportunities to innovate with new technologies that will deliver improved patient outcomes, better educational experiences, or faster research discoveries. Jamf's focus is to simplify work, not just for IT and security staff that are looking to consolidate tools and achieve better administrative workflows, but also for the workers and potentially the patients who are utilizing Apple and mobile technologies in their work and in their healthcare journeys. The Jamf platform, which we talked about earlier, was designed to help organizations achieve meaningful outcomes with end-user technologies. And in the case of trusted access, that outcome is an experience that users love and organizations trust. Trusted access is a zero trust outcome, one that can be realized, not just one that exists on a whiteboard because it's too difficult or onerous to implement. More specifically, though, trusted access is an outcome where we have assurances that only authorized users on enrolled devices that are secure and compliant can access sensitive organizational data. That means that only those users your organization trusts, on devices you have a relationship with that have been proven to meet your standards are the ones that are accessing your most critical applications and data stores. To achieve this outcome, we need to bring together capabilities that span a number of traditional product silos. Capabilities that, when joined up in one platform, allow efficiencies to be realized that were not possible before. And along with this, we achieve an outcome that's more informed and dynamic. Effectively, we're bringing together here capabilities that span device management, endpoint protection, and identity and access categories. The journey to achieving trusted access begins for many with device enrollment. This is the phase of trusted access where the organization effectively forms a relationship with a device that's accessing critical work resources to really understand how that device is configured, make sure that it's ready to work, but also ensure that it's safe to be used for work. Device enrollment should support devices of all types, Mac and mobile, as well as company-owned and personally owned devices. It's important that the enrollment technologies in use support the appropriate device use cases as well. For example, zero-touch deployment capabilities can enroll a device fresh out of shrink wrap without any end-user interaction. Similarly, the embrace of account-driven user enrollment allows a work partition to be created on a mobile device that allows for a privacy-aware management experience that controls only the work applications. A balance can be struck when embracing modern frameworks to enroll devices that are utilized for work, regardless of who purchased them and how they are managed. Through enrollment, we effectively unlock capabilities that allow for policy actions to be taken. Many times these actions are taken through automation frameworks that keep the user productive and minimize work disruptions. Patching applications, for example, maintaining work environments and configurations, deploying scripts and more. All of these are capabilities that we can expect from these types of automation frameworks. And when things go sideways on a device, when the platform is not in a state that's appropriate for work, having this underlying capability allows us to take a number of actions that can remediate a problem. Examples would include things like updating the operating system, removing an application, enforcing passcode locks, resetting local accounts. The list goes on and on. All of these options that we want are at our disposal for both day-to-day management and for threat remediation when we have that relationship established with the work device. And speaking of threats, the Jamf platform is serious about security right from the start. A device is really only as secure as it's configured to be. Jamf includes capabilities to establish and maintain good device hygiene. And one basic example is enforcing passcodes and encryption on devices that are used in clinical settings. But that's just one example of a compliance control. Apple devices are unique in how they're built and the controls that are exposed for configuration. And if your organization is aligning to standards like the CIS benchmarks, NIST 800, or DISASTIG, achieving compliance on a Mac is challenging without the right tools. Jamf makes this easy with ready-to-use graphical capabilities in the form of an editor that allows you to pick and choose which baseline you want to start your journey on for compliance and fine-tune it for your organization's needs. We also provide not only the capabilities to configure and deploy those settings, but also the documentation that you can provide to your compliance teams and potentially even your auditors if you're doing reporting. Of course, good foundations are only a starting point for the trusted workforce. You'll need to provide purpose-built malware protection, and Jamf is built right into the same tool that helps you to achieve compliance. So from establishing good baselines to protecting against malicious attacks, Jamf has a single security stack that's able to defend the device and provide rich system telemetry to your central logging infrastructure or your threat hunting apparatus. And that's not all. Jamf also includes the ability to prevent inbound attacks like phishing, social engineering attacks, and to do so across all applications on the device, including applications that are integrated into all modern devices like iMessage, instant messaging, SMS, social media messengers, and more. So regardless of which work tools or non-work tools your users are utilizing on their work device, you're able to identify inbound attacks, implement policy, and notify the user when an interruption to their workflow has occurred. There are also opportunities here to provide end user education in the form of awareness notifications and mitigation steps when you want your end users involved. You'll also notice the notification screen include risk indicators so the user understands the current risk profile of their device and how that may actually impact the access that they are allowed to have or they are prevented from having because of decisions that have been made on their local device. In rounding out our trusted access journey, Jamf has also taken steps to incorporate identity into the foundations of the platform. Leveraging your organization's cloud-hosted identity provider, we enable account creation, password sync, and user workflows that utilize a single end-user identity. This means that users first, and in many situations only need for a password, is when they first log into their system. From that point forward, more secure application access can be achieved using modern identity frameworks and techniques. The passwordless future is suddenly a reality. And these identity and access frameworks are not limited to on-device applications either. Jamf's capabilities include a modern remote access solution, a true zero trust network access or ZTNA implementation that's resource efficient on the device, incredibly performant, and it provides continuous conditional access that is powered by Jamf's endpoint security stack, along with a consistent experience across any modern device. So from Mac OS to iOS and iPadOS, Android and Windows, Jamf has capabilities to connect your end users to all of your business tools, regardless of whether they live on-prem behind a firewall, in a public SaaS infrastructure, or in private cloud. As you can see, Trusted Access truly is a complete stack of technologies that enable a true zero trust experience. From zero touch deployments to the user's first sign in on the device, all intelligence on the device feeds from one component to the next to deliver an optimized experience that can be assessed and reported for end-to-end risk management. And with that, let's now explore Jamf security in a real-world deployment.
Hi everyone, Adam with Jamf. Let's talk about Apple security at scale. A great example of this in healthcare is our customer UMC Utrecht. Although UMCU had an active macOS deployment prior to the pandemic, with users across their entire academic medical center using MacBooks, the growth of Mac skyrocketed in 2020. The leadership team approved the choice program, so no matter what role you're in at UMC, you could choose a Mac if you'd like. A population of once 400 Macs jumped to over 2,000, with many of the researchers, providers, and employees working remotely. So since the employees at UMC get to choose their own devices, there's a really good mix of over 2,500 Macs, 12,000 Windows desktops and laptops, 6,500 iOS devices, and 300 Android devices. All of these devices, no matter the platform, need to be managed, protected against any web or on-device threats, and have any kind of remote access secured. At UMC, it's extremely important that every piece of technology that they employ can deliver the best security and user productivity outcomes across all the devices that they support. A great example, given the positive private access experience on UMC's Mac fleet, they're currently rolling out that ZTNA solution across 300 of their Windows research computers. So UMC's been a Jamf customer since 2013. In 2013, the genetics lab was tasked by the IT leadership to find a modern Mac management solution. And they had three goals in mind: reduce cost, make managing the Macs easier and more secure, and that solution had to be user-friendly. UMC tried out a couple different solutions, and ultimately they wound up purchasing 100 Mac licenses of Jamf Pro. Fast forward to 2017, that initial pilot went very well, that they invited other research departments, and the IT department followed that lead. Jamf was such a big hit that soon they expanded upwards of 450 licenses. And then in 2019, all those research labs were brought under a centralized IT. And at that point, given the COVID pandemic, those numbers really started to skyrocket well above 2,500 devices. So UMC had countless areas where their device registration and management improved, but COVID-19 pandemic was really that area where this program started to shine. So given the need for remote work, they wanted to make sure that they presented the user with as little end user interaction as possible during their rollout, while still providing all the necessary configurations and applications they need to be productive and compliant. One of the big mandates that was coming down from the security officer was to mandate stricter access to sensitive data. To do this, all of the managed devices needed to be on a certain VLAN and then forced to connect to apps over a tunnel. Jamf's Zero Trust Network Access solution enforced Jamf Trust on these devices, and that provided the best support process available, allowing users to remotely connect in a secure and user-friendly manner. So all UMC Apple endpoints must run Jamf Protect endpoint protection in order for the ZTNA Jamf Trust agent to establish that remote connection to those remote applications. Access is limited to the users authorized for those specific applications. This benefited the end users because they got a really fast connection. Access to all sensitive apps is enforced. So essentially, only users who are granted access to an application are provided that access. If the user does not have Jamf Protect installed on their computer, they can't activate Jamf Trust. If Jamf Trust is not enabled, you can't access any UMC resources. And this is why the team at UMC loves Jamf so much, because all the components just work so well with one another. Next, we'll talk about the tools that they use in addition to Jamf Pro, the first being Jamf Protect. So when UMC identifies a threat on an endpoint, they already have an isolation and remediation of that computer in place. So when Jamf Protect identifies an issue with a Mac, it'll place that Mac into a special smart group. That smart group is an exclusion scope to receive appropriate certificates that grant access to Wi-Fi or VPN until the user contacts the help desk for remediation. When recovery can be managed through self-service, Jamf Pro can very easily provide instructions to guide the end user and bring their Mac back to a well-known state. For very extreme cases, they can even reinstall macOS on a device and redeploy any existing applications to ensure that the computer is once again safe and fully trusted. So moving forward, UMC is continuing to expand with the Jamf ecosystem, bringing in patient bedside iPads, even more stricter access to that sensitive data, and then gating their applications with ZTNA. Currently, they have over 100 apps that have those very secure granular access policies, but soon we'll have more than 600 applications that are behind ZTNA.
Now, as you can see, UMCU has been on a journey towards trusted access, spanning both their desktop and mobile fleet. Before we leave today, I wanted to give you a taste of what this could look like for your healthcare system. And to tie this back to the trends and risks that Mike talked about earlier, I want to show you how trusted access could look across a few different mobile scenarios.
Now, another common deployment for either providers or frontline staff is a one-to-one deployment, where a single end user maintains the use of a personalized device for its entire life cycle. While great for providers and staff, we see many leading health systems also selecting a one-to-one single user deployment model for nursing staff with very positive results. If this is your choice, we can make things a breeze. So with Jamf's integration with Apple's native deployment services, automated enrollment is a breeze for users and IT. Admins can predefine experiences for devices before they're even powered on, and even allow users to have the full unboxing experience. Once powered on, the device will be managed and secured automatically. So what does a one-to-one deployment of a clinical iPhone look like? Here we have an example. You'll see the device being turned on for the first time. We're going to go through those normal iOS setup assistant screens, but then we're going to go ahead and bypass everything else except for Face ID. We're going to set up Face ID here. And once we got Face ID set up, all of our appropriate applications and configurations are going to immediately be applied upon enrollment. We refer to this as zero touch or automated device enrollment.
While corporate-owned tech can range from one-to-one to shared deployment models, there is another category I want to discuss, BYOD.
You might think that personal devices aren't being used in healthcare. You might want to think again. Studies have shown the scary reality that more healthcare providers that we'd like are using unmanaged, unsecured personal devices to send text messages that contain sensitive data. And it makes sense that, people want to reach out via the simplest means to communicate. And often it's what's in their pocket. But with the heightened security risks and trends, wouldn't it be great if there was another way? Good news, there is. If your organization invests in the right technology platforms, apps for secure, HIPAA-compliant provider communication and EHR access can be deployed in a matter of minutes. And Jamf provides a simple way to manage and secure personally owned devices without that scary big brother feeling from the IT or IS teams. So what does this new way to BYOD look like? Here you'll see a demo of a healthcare provider on their personal device already logged in with a personal Apple ID. We're going to tap through settings, and we're going to complete account-driven user enrollment. So right now I'm signing in with my Azure Active Directory credentials. You'll see I got an iCloud for Work account. Once I'm fully authenticated, we're going to allow remote management. And now the device is enrolled into Jamf. If we tap back a couple options here, you'll see we have 2 Apple IDs on this device. So now the user is going to open up self-service. And once they open self-service, they're going to download Jamf Trust and their EHR app. As an example, Epic Haiku and other clinical communications apps. Jamf Trust is installing. Next, we're going to go ahead and open up Jamf Trust, and that's going to configure our ZTNA, or Zero Trust Network Access. And that's going to give us secure network access to those corporate applications and resources. And that's it. They're ready to use their work apps without any hassle of enabling a VPN, and everything's enabled on demand. In this case, we're going to go ahead and launch Epic Haiku, which is pre-configured by Jamf Pro with all the correct hospital site information. This means that the device and apps are managed, secured, and ready to go.